High blood pressure, also known as hypertension, affects hundreds of millions of people worldwide and is one of the leading risk factors for heart disease and stroke. Many patients rely on daily medications to control their blood pressure, but for some individuals, these treatments are not always effective. Researchers have explored ways to treat hypertension by targeting mechanisms regulating blood pressure. To understand how renal denervation works, it is important to first understand how the body regulates blood pressure. The kidneys play a critical role in controlling blood pressure by regulating fluid balance, blood volume, and hormone release. They also communicate with the brain through a network of sympathetic nerves that surround the renal arteries. These nerves send signals that influence how tightly blood vessels constrict and how the kidneys manage sodium and fluid levels. In many patients with hypertension, this nerve signaling becomes overactive. The result is increased blood vessel constriction and elevated blood pressure throughout the body. Traditional medications attempt to control these effects by altering hormones or relaxing blood vessels. Renal denervation is designed to interrupt the nerve signals that contribute to persistent hypertension. The procedure is performed using a thin catheter that is inserted through a blood vessel, typically in the groin, and guided toward the renal arteries. Once the catheter reaches the arteries that supply the kidneys, a specialized device delivers controlled energy to the surrounding nerve fibers. This energy can be delivered through radiofrequency waves or ultrasound technology. The goal is to selectively disrupt the overactive sympathetic nerves without damaging the artery itself. By reducing these nerve signals, the kidneys receive fewer instructions that trigger blood pressure elevation. As a result, blood vessels can relax and blood pressure levels may gradually decrease. This minimally invasive procedure typically takes less than an hour and does not require major surgery. Patients usually return home the same day. Clinical studies have shown that renal denervation can lead to meaningful reductions in blood pressure for many patients with resistant hypertension. Unlike medications that must be taken every day, the effects of this procedure may last for years. For individuals who struggle with medication side effects or inconsistent adherence, this approach offers a potential alternative. Another advantage is that the treatment directly targets the nerve pathways that contribute to high blood pressure. Patients who undergo renal denervation usually recover quickly and can often return home the same day. Because the procedure is minimally invasive, complications are relatively uncommon when performed by experienced specialists. Researchers are continuing to study how this therapy can be combined with other treatments to improve cardiovascular health. As evidence grows, renal denervation may become an important tool in managing difficult cases of hypertension. As medical technology continues to evolve, device-based therapies like renal denervation may play an increasingly important role in treating chronic diseases by targeting the biological systems that drive conditions such as hypertension, rather than relying solely on medication. Future advanced medical technology may greatly improve treatment precision worldwide for patients everywhere.